Have you ever heard someone claim that medications were masking symptoms? That it was just a way to avoid getting to the root of a problem? I created this series to discuss the causes and treatments of various conditions. So let's get to the root of it. This time, atopic dermatitis or atopy in dogs. So what is atopy? Atopy, or canine atopic dermatitis, is a genetically predisposed inflammatory and pruritic or itchy skin disease. Clinical signs are varied and depend on the underlying cause of the condition. You can't just look at a dog and say, that dog has atopy. The disease is diverse, with things like genetic factors, size of lesions, if it's acute, if it's chronic, or if there's a secondary bacterial infection, all having an effect on it. Because of this, there's a series of steps that must be taken to diagnose canine atopic dermatitis. First, we need to rule out other diseases. There are a lot of other diseases that can mimic or even overlap with atopic dermatitis. This chart gives a rundown of quite a few of them. Ectoparasites like fleas, scabies, or demodex are common causes of itch in a dog. Flea allergy dermatitis was super common when I lived in the South, but not as common now that I'm in Arizona. You can rule out these parasites by using skin scrapes, cytology, and hair plucking. Pets should be on flea and tick prevention to rule this out as a reason for the itch. Next is to look for skin infections, like staph or yeast. These are common in dogs with atopic dermatitis, mostly due to the breakdown in the skin barrier. You can test for these using cytology of pustules, though an impression smear will do. Sometimes bacteria culture is needed, especially if the dog has not responded to antibiotics. So step one in getting to the root of atopic dermatitis is to test for these parasites, using things like skin scrapes, cytologies, and making sure the dog is on flea and tick prevention. Next, we need to work through allergic skin disease. Cutaneous adverse food reactions, or CAFR, can also contribute to canine atopic dermatitis. They may have both conditions, or this can put an atopic dog into a flare. While these dogs tend to have GI signs as well, they can fly under the radar. If your dog is itchy year-round, this is something to consider. How do we get to the root of food reaction? Elimination diets. Elimination diets are done in multiple ways. There are prescription limited ingredient diets or novel protein diets, and there are home-cooked options. Veterinarians tend to recommend prescription diets because of the decreased likelihood of cross-contamination. What do I mean by that? Multiple studies have been done on commercial dog foods that call themselves limited ingredient or claim to have only novel proteins. What they found is 60 to 80% of them have cross-contamination, meaning a chicken-only diet will have beef in it. Prescription diets are created in an environment that decreases the likelihood of this cross-contamination by separating facilities and cleaning thoroughly between batches. Elimination diets must be very strict. The food is fed for at least 8 weeks with no other treats or foods. If they respond, that diet should be continued. If not, a different elimination diet may be chosen. Elimination diets are becoming harder and harder to do because the ideal elimination diet would be with a protein a dog hasn't been exposed to, like rabbit or kangaroo. Unfortunately, these proteins have made their way into the commercial food market, so the likelihood of feeding a dog a protein they haven't had before is lower than that in the past. Elimination diets are also tricky if the dog is on medications, as they can sometimes have flavoring that disrupt this elimination diet. After 8 weeks, the old food is reintroduced. If the symptoms return, then diet involvement is confirmed. This is typically where people interrupt me and recommend hair or saliva testing for food allergies. Unfortunately, these are absolute bunk in veterinary medicine. Multiple studies have looked at these tests, including sending teddy bear hair or saline to be tested. Shockingly, the saline and teddy bear hair came back allergic to things. Unfortunately, blood tests are no better for diagnosing food allergies. So far, we've eliminated ectoparasites by testing for them and using flea and tick prevention. Now we've eliminated possible dietary involvement with an 8-week strict elimination diet. At this time, we can feel more comfortable saying a dog has atopic dermatitis. The next step is to determine environmental allergy involvement. As we've already discussed in the food component, saliva and hair tests are not useful. There is an allergen-specific immunoglobulin E serology, also known as ASIS. This is a blood test that measures circulating allergen-specific IgE, so it often shows positive results in non-allergic dogs. The gold standard for testing for environmental allergies is intradermal testing. This is done by sedating a dog and injecting allergens under the skin to determine reaction. It's not a perfect method. There are false positives and false negatives. This information can be used to create allergen-specific immunotherapy, or ASIT. This is created using the results from the intradermal testing as a way to desensitize a patient to the allergens. Intradermal testing cannot be used for food allergies. As you can probably guess, ASIT does not work instantly. It's a slow exposure, gradually increasing doses, and can take up to a year to start working. Elimination diets take weeks, and during that time, an atopic dog will be itchy and miserable. It wasn't that long ago that dogs were euthanized due to uncontrolled itch and poor quality of life. This is likely why treating the itch is considered one of the earliest steps with Atopy. This is a flowchart from the 2023 AHA Management of Allergic Skin Disease Guidelines. It starts pretty similar to what we discussed: physical exam, skin scraping, ear cytology. But step 3 is treating the itch itself. This can be done with several different medications. Then you treat secondary infection, then you recheck. Diet trial is lower on the list because food allergies are not actually that common in dogs. Only about 1% of dogs have food allergies, and about 5 to 15% of itchy dogs were found to have food allergies. This medical intervention absolutely improves quality of life and treats the symptoms and often the root of the problem. There are several treatment modalities. Steroids are the oldest treatment for canine atopy. Steroids help with inflammation, and they start to work within hours. They're also very cheap, which makes them appealing in situations where a full workup is not financially possible. Steroids should be avoided in pets with congestive heart failure, diabetes, or Cushing's. Dogs cannot and should not be on steroids long term. The side effects make them less desirable, with things like increased thirst, increased urination, increased hunger, obesity, and panting being some of them. Cyclosporin is another older treatment for canine atopy. This works by inhibiting calcineurin, which modulates T cell function. This is a slow-working medication taking several weeks before we see improvement. The most common side effects are vomiting, diarrhea, and gingival hyperplasia. It does have some drug interactions and should not be used in animals with cancer or kidney disease. Apoquel and Zenrelia are Janus kinase inhibitors, though they work on different receptors. This blocks signals from pro-inflammatory and pro-itch cytokines. They are designed to be used long-term. They should not be used in dogs with cancer, Demodex, or serious infection due to its relationship to the immune system. Whenever I talk about Apoquel, I invariably have people tell me that it causes cancer. This is not true. In fact, multiple studies have been performed on Apoquel to assess its safety. They found that dogs on Apoquel develop cancer at the same rate as dogs not on Apoquel. In fact, there's even a case study of Apoquel being used to treat T-cell lymphoma in a dog. The most common side effect with Janus kinase inhibitors is vomiting and diarrhea, as well as skin infections. One of the newer drugs is Cytopoint, which is a monoclonal antibody that neutralizes IL-31, which is an itch cytokine. This is given via injection by a veterinarian every 4 to 8 weeks and can be used long term. It works fairly quickly, within hours to days. Most common side effects are vomiting, diarrhea, and lethargy, with rare allergic reactions. Each of these drugs work different ways and have different indications. None of them are masking symptoms or putting a Band-Aid over the problem. These are treatment options for an incurable disease. The only way to really get to the root of this problem and fix it is to unbreed your dog, or find what your dog is allergic to and remove it from your county. And yes, I mean unbreed your dog, because there is a strong evidence of heritability with atopy. In one study of Golden and Labrador retrievers, the heritability of atopy was estimated to be 0.47. I know we already touched on food allergies and how little they contribute to this disease process, but I want to bring up a myth I frequently see online about curing itchy dogs. Accounts will say you can just feed a homemade diet and atopy will go away, or that carbohydrates are the reason your dog is itchy, or that raw-fed dogs have no atopy. While homemade diets can be very useful in elimination diets, they're not a cure for atopy. I also have an entire video on raw food myths, including debunking the raw food atopy claim. Plus, the most common food allergens in dogs are beef, dairy, chicken, and wheat, despite what the internet may say. So what about fish oils and omega-3s? There's great evidence that using this as an adjunct therapy can be helpful. In fact, many of the prescription skin diets utilize omega-3 fatty acids as a way to support the skin and lower itch scores. Other studies have found that fatty acid supplementation allowed clinicians to lower the dose of steroids or other medications. More recent studies have looked into fish oil supplementation as it relates to joint disease and osteoarthritis. The biggest issue these studies point out is that the dose of fish oils, as well as the formulation, play a huge role. For example, most diets contain N6 fatty acids, and studies with N3 fatty acids did not show a huge improvement in pruritus or itchiness, despite improving inflammatory scores. Studies looking into fatty acid supplementation varied greatly. Some N3 studies had doses from 3 to 66 milligrams per kilogram per day, and N6 ranged from 0 to 138 mg per kg per day. And then ratios between the N6 and N3 also varied greatly from 9 to 1 to 20 to 1. So why not just use fish oils or enriched diets? You absolutely can, but not all dogs tolerate the diets, and for many dogs it's just one of the many tools used to treat atopy. To claim it's a panacea for atopy is just wrong. Given that the supplement industry is unregulated, there's a serious likelihood that dosing with over-the-counter fish oil products will be inconsistent. There are some companies and products that do batch testing and studies to ensure they're following proper guidelines and have quality control. Unfortunately, this is not common, and it's far more likely that owners are throwing fish oil on their dog's food and only succeeding in making their dogs smell like fish. The take-home message is this: itchy dogs are complex and require a lot of time, energy, and often money to fully work up. Not every owner can pay for the testing required to confirm canine atopy. Not every owner has access to a dermatologist to perform intradermal testing. This means the workup, diagnosis, and treatment of an itchy dog varies greatly from patient to patient. To say that a veterinarian offering medication to an itchy dog is not getting to the root of the problem is not accurate. Saying medications don't address the root of the problem isn't accurate either. Sometimes the root of the problem is genetic, or not something that can be fixed by a diet change or a flea and tick prevention. The shaming of owners for using medications to help improve their pet's quality of life absolutely has to stop. You are not a bad pet owner because you couldn't afford a referral, or because you weren't able to complete an elimination diet or a food trial. Don't let some influencer with a discount code to their supplement tell you you're not a good dog owner because your dog is on Apoquel or Cytopoint or eats a hydrolyzed protein kibble. Thanks for joining me as we got to the root of your itchy dog.